outside of the room and I checked the chart. My name is Billy Partita. I'm a student nurse. Hello. I'm going to provide privacy for the patient. I did check the chart and the patient does not have any allergies. Hi, good afternoon. My name is Billy Partita and I'm your student nurse. We are going to be inserting an IV. The doctor has put some orders in stating you have a little bit of dehydration, so he wants to give you some fluids. Can you tell me your name and date of birth? And he says that his name's
Hattie Hansen, March 2nd, 1970.
Okay, and I verified this with the bracelet, and is it the correct name and date of birth? So what we're going to be doing, as I said, is inserting the IV into your arm to give you fluids. Okay, you will feel a little poke. I'm going to insert the needle, and then I will insert the catheter, and the catheter is what stays in your arm. Okay, do you have any questions?
No.
Okay, what is your dominant hand?
Right hand.
Okay, so we'll be using your left hand so you have more mobility while you're in the hospital. Have you had any surgeries for lymph nodes or a mastectomy?
No.
Okay, so I'm going to wash my hands and I will place the protective chuck under your arm. First I will look for a vein. We want the vein that is straight and distal from any joints. I will place the tourniquet on your arm 15 to 20 centimeters above the venipuncture sites. It's going to be a little tight while it's on your arm. And I'm going to check for a radial pulse, making sure it's okay. So I'm looking for your vein. I see that you have nice veins. So I'm going to go right here when I put the IV in your arm. Right now I'm going to loosen the tourniquet and prepare my solution. So I will wash my hands and then put on my gloves. So I had gathered all my stuff before I came into the room, and I have alcohol swabs. I have the needle, the saline lock, and the saline flush, a tegaderm, and tape. Okay, so I'm first going to prepare the saline flush, cleaning this off 15 to 20 seconds or per protocol at your facility. I will put that in the garbage. You want to get the bubbles out of your saline flush, so you will prepare it and insert this here, and then I will move my stuff closer. Get this ready. I'll get the tegaderm ready. Okay, so now I'm going to put the tourniquet on your arm as we discussed before, 15 to 20 centimeters above the venipuncture. I'm going to clean off the sites going from inward to out, and then I'm going to let that dry for a moment. While I let that dry, I'm going to prepare my needle, and you want to go 15 to 30-degree angle with your dominant hand, pulling the skin taut, and I did check a radial pulse and you do have arterial blood flow, so we will go taut. I'm going 15 to 30 centimeters. angle, 15 to 30 angle I meant. And when you see flash, you want to go half a centimeter more in and go level with the skin. And then advance the catheter into the patient. Holding the catheter, I will then dispose of my needle and put on the saline lock. Okay. You will unclamp, release the tourniquet, put 1 to 2 milliliters of flush to make sure the IV is patent. Reclamp the saline flush and remove. Then you want to put tape to secure. Okay, and then I will put on the Tegaderm, making sure not to touch any area, and you want to put it in the middle, not on top of, only on top of the catheter portion. Okay, that's secure. So I will remove this. You will want to put the your initials, date, and time that you inserted the catheter for the IV for the patient. And then I'll put one more piece of tape here just to secure the saline lock for the patient. And then lifespan considerations would be if it was a ped or a child, you would want to get a smaller gauge for the needle. You want to go document where you placed the IV, so date, time, in what area, antecubital forearm that was placed, how the patient tolerated the procedure. And I'm going to take off my gloves. I will dispose of the needle in the sharps container. I'm going to wash my hands and ask the patient how they're doing. They say okay. So then I went and I documented everything for the patient. That's it.